Any further comments about that question, Mr. Bocheri?
Thank you, Cindy. First and foremost, the insurance companies are acting like credit card companies. In fact, since we've begun the debate on health care reform, they have increased their profits since March of 2009 by 26%, overcharging folks before any of these premiums and before any of these reforms have been rolled out. So they are acting like credit card companies. The state exchanges will pick up folks who have been unemployed or trying to take their insurance from job to job. And also, it's going to allow for competition. We're going to be able to set up compacts between states and allow for us to buy across state lines. One of the biggest differences in our campaigns is that Mr. Renacci would like to repeal this law. So children like Jay Hawkins, who now has an insurance card, Katie, who now has insurance because she can stay on her parents' plan, he wants to repeal all of that. It's on his campaign literature. It's been all over his website. So let's just be clear. I don't want to take away Jay Hawkins' insurance card. I don't want to deny Katie the opportunity to stay on her parents' insurance plan so that she can seek coverage and care. She's suffering from renal failure. We have a lot more work to do on insurance reform and making sure that insurance companies aren't behaving like credit card companies.
Other comments, Mr. Renacci?
Yeah, it's interesting, again, that Mr. Bocheri always continues to use half-truths when he talks about things. I have said I want to repeal and replace the health care bill because this bill is toxic. I want to take provisions that are good, which are the pre-existing conditions and some of those ones I talked about, and put them in a 4 or 5 page bill, and then come back and make sure that the citizens and employees of many companies in this country do not end up with health care costs skyrocketing so they cannot have coverage. And then ultimately they lose their coverage and they lose their ability to cover their children. So there is a difference between the two of us. It's replace and repeal. Now the other thing you notice, and listen to what he says, we, as though the government, we the government are going to do this for you, and we the government are going to do that for you. Major difference. We don't need the government in our lives. We do not need the government in our lives, and we can do better with less government. That's the difference.
Okay, other comments? Mr. Blevins?
Mr. Bocheri spoke that we still need to improve the current health care bill. My question to that would be, then why not wait and get it right the first time?
Okay, other comments? Mr. Ross?
Yeah, I'd like to point out that what we may have wanted with the health care bill was a beautiful young thoroughbred, and what we got by the time it got through the process was a two-legged, dumb, blind, deaf camel. We got a bill that, okay, and that's because of the process that developed that program. The process is political and it's intertwined with special interests, wealthy donors. Okay, that's my biggest concern, is we're dealing with bills. They act as though they're going to be independent, free agents when they get to Congress. I'm going to do this or I'm going to do that. They can't possibly do that. They're Republicans or Democrats. When they get to Congress, they're going to be handed the playbook by their parties and they're going to be told to follow them. And they're going to do that because, just as you saw all through this decade, they have followed the political party playbook every step of the way, and that's my complaint.
Okay, other comments? Mr. Bocheri?
May I add, please? First and foremost, there is competition set up in there. It was a Republican idea. We incorporated it, but only in Washington can you propose an idea, introduce legislation, and then campaign against it. Republicans voted in lockstep against state children's health insurance programs. They also voted against many of their own ideas that were included in this bill. So we've got to start somewhere, and we've got to make sure that this job is not left undone. One of the biggest votes we have yet to take, we did it in the House, we need to do it in the United States Senate. There's only 2 industries in the United States of America that aren't governed by antitrust laws. One of them is Major League Baseball, right? And they're paid millions, aren't they? And then we have the insurance industry. And we voted to make sure that they are governed by antitrust laws so they can't form monopolies and charge whatever they want in the state of Ohio. The second thing we've done to help control costs with competition, with broadening to make sure that folks buy private insurance. We're not telling you have to buy a government plan. We're saying let's buy a private insurance on the private market. That's what's going to be in these state exchanges.
Other comments? Mr. Renacci?
Yeah, Mr. Ross made the comment that the Republican candidate or Democratic candidate is going to go down and just do what the Republican or Democrat Party wants. I could tell you that's not the case. My opponent now, you know what his history is over the last 2 years, and you know what his votes were. One thing our founding fathers did was they set up a system so that House seats have the opportunity to change every 2 years. And what I believe in is that if you go down there and you violate the trust of the people in the 16th district, then you should be removed after 2 years. That's the difference. So if I am elected as a Republican and I violate that trust and I vote with the Republican Party versus the 16th district, I should be removed too. So that's really the difference. I'm going down there to represent this 16th district.
Other comments? Mr. Ross?
I'm glad he had that to say. Part of what I'd like to do with my comprehensive local plan is pull the leadership away from Congress and the parties to the local officials. If we had a comprehensive plan set in place, they would answer directly to that committee and would be told by the committee, this is what we need for the development in this area. We need you to go get this resource, bring it back to us. We can check it. We can make sure that you actually did it. You actually performed the way we want you to. We design what they do. They don't get to Washington and get handed a playbook. I can tell you that everyone out there is going to say, oh, I'll be an independent, trust me. And what are you going to get? What can you do? You're going to have to vote for another one the next 2 years. And if we keep playing the same game, we're going to get the same outcome. Something's got to change along the way. And I think what we have to do is take the supervision and leadership back to the local level and make them work for us here, not there in Washington.
Thank you. Mr. Blevins, do you want to comment or not? No? Okay. Let's move on to another question then. On health insurance, why must a person be working 30 hours a week before getting insurance when you can get just as sick working 20 hours a week? So the question is, why must a person be working 30 hours a week before getting insurance when you can get just as sick working 20 hours a week? We'll start with Mr. Renacci.
Well, you know, I believe the 30-hour, again, I've been a businessman for over 27 years, and the standard of 30 hours, working 30 hours a week, is really a standard that could be written into the health insurance plan. It could be less, it could be more. I mean, I had a business at one point in time where I had over 3,000 employees, and I can tell you we had the standard less. So the standard really is based on the plan, the policies within the plan, and how that company wants to move forward and run their plan with their individuals. But I can tell you that in the self-insured plan we had, which had over 3,000 employees, our plan wasn't 30 hours, it was actually less.
Thank you. Mr. Ross?
I have no part in designing that rule, and one of my complaints with the health reform bill is the fact that it did not take the burden of health insurance coverage off the backs of employers to begin with. I feel like that's one of the biggest problems with the fact that we have trouble competing with companies from other countries, is the fact they don't have to pay for their employees' coverage. They have affordable insurance, and they also have a base of a government-sponsored insurance, which they also threw out of the health insurance bill. If they had a chance to compete, get rid of the burden of covering their employees with health insurance, it would be more affordable, the companies would be more competitive, and they could afford to hire more people. So one of the biggest things we have to think about at some point, if that's not going to become where the employers just go under and move somewhere where they don't have to pay it, that's going to be something we have to deal with here, is get that off their backs.
Thank you. Mr. Blevins?
When you purchase insurance through your employer and their insurance company have set the parameters and agreed into a contract that can stipulate some things. I think what we can do is, again, by increasing competition, we can reduce the price for the individual to buy private insurance and make it more portable so that it's not predicated on how many hours you work, or even if you do work. As long as you can afford the insurance, doesn't matter if you work 20 hours, 30 hours, or as long as you're making payments on your premiums, you're covered.
Thank you. Mr. Bocheri?
Thank you. It's good to hear all these suggestions, because guess what? They're all in the bill. In fact, you can buy across state lines now, and we have personal responsibility built into this bill. In fact, that wasn't a Democrat idea. It was actually a Republican idea back in 1993, that if If you are able to purchase health care insurance and you can afford it, you should do it, and you should be able to take it from job to job to job and not have any lapse in coverage. So you're exactly right. People who work less than 30 hours can get just as sick as folks who work more than 30 hours. Let me tell you about a young man who's affected by this. Jack Hillier in our Congressional district owned a motorcycle dealership. He lost his dealership, but he was providing insurance for his employees and for his family. Well, he had to go out and buy it in the private market. Well, he had diabetes. He couldn't afford to purchase it because he had a pre-existing condition. So he didn't take his medicine, ended up getting a heart attack because of this. Now he had 2 pre-existing conditions. This 58-year-old man was sitting in my office in Washington, D.C., fighting back tears, saying, "Congressman, I pray to God I can live for 2 more years so I can get on Medicare." In a country as wealthy as ours, I remember in 2004, we flew to Iraq carrying $1 billion of checks, our Health and Human Services Director, to make sure every man, woman, and child in Iraq had universal health care coverage. If it's good enough
Thank
for
you.
Iraqis, it should be good enough for Americans.